Welcome back at 6:15. Baptist health cardiologist Dr. Scott Davis is in the studio this morning with some new heart research just released. Dr. Davis is back after a weekend at Mardi Gras. We'll talk about that later.
A lot of fun.
Yes, sir. Good morning. Good to have you. Okay, so we often hear about reducing salt in our diets that impacts our heart and blood pressure, but we never really know what is too much.
So the party line from the American Heart Association and other, heart-focused medical groups would say 1 teaspoon a day or less. And man, that's sometimes hard to achieve. Realize that over 70% of your salt intake comes from someplace besides the salt shaker, from table salt. And so we've done a number of studies at looking at reducing salt intake and lowering your risk of stroke and heart attack and heart disease. There was a big study that came out in 2021 looking at salt substitute and stroke reduction. And then most recently, this study that came out last month looking at then a follow-up group of folks that had had previous stroke that then they randomized to 7,000 or so patients taking regular salt intake, and then the other group with a salt substitute using potassium as a substitute for sodium. And they showed a 14% reduction in stroke and a 12% reduction in death. And so it speaks to the fact that, look, anything you can do to reduce the sodium component of your salt intake is going to then, that's the key driver to this. And so a salt substitute that may use potassium as a substitute was shown, A, to reduce risk, and B, it's also safe, because certain people, have been concerned about, well, if I substitute potassium, then I might get this hyperkalemia. I may get too much potassium in my diet. And that was shown also to be safe as far as an alternative. So, the next question is, as we look at the way the FDA is starting to regulate certain, pieces of our diet, and cutting back on daily sodium, is there an opportunity to say, to move into the food space and the U.S. food production space to start limiting the amount of sodium that's in processed foods? Because that's kind of the big X factor here.
All right, Dr. Davis, we learn so much from you every time you come in, and we'll talk more about Mardi Gras in just a moment.
Absolutely.
Yes, sir. Well, if you want to get in touch with Baptist, go to the website or call the number on the screen.